As we move into spring and things start to bloom, maybe think about how you could bloom and improve yourself, including your smile and your teeth. Joining us right now, Dr. Stephen Marsh from his office. Doctor, it's always good to see you.
It's a pleasure for me to be with you, Joe, and hopefully we'll have a nice spring if the Cleveland weather cooperates.
Right, hopefully. You know what? I want to thank you for your time, but I also want to pass on. Someone has thanked you with a pretty interesting thank you card. Please share that with us right off the top.
Thanks, Joe. So this is a patient, and we love that. And so we had done a lot of work on her and remade her smile. And she saw this card. She said, "I couldn't help but think of you, and all the things you and your group could do in making these smiles look much better." And you
Well,
can see they still have masks, and at some point those will
there it
come
is.
off too.
It's timely. All this time I had no idea I should put a mask on my dog as well too. But all right, let's move on with some of the patients you've had recent in the last couple of months where you did big time improve their smile and they're
Thanks,
blooming
Joe.
right now.
Absolutely.
Who's
So our
this?
first, yeah, so this is Patrice, and she was always bothered by her teeth. Over the years, she was in her 60s, the teeth had turned dark. Sometimes it happens from people who actually, in a sense, overbrush over the years. So we did 10 upper porcelain veneers, 10 on the bottom, reshaped the bottom, and she said she feels 10 years younger with the change in shape and the change in color in this
Wow, what a
patient. So this
difference.
is Kyle, and newly moved to Cleveland, never liked the way his teeth looked when he was younger. They weren't able to do orthodontics. He said, "What can we do?" And I said, "We can reshape the teeth. On the lower, we did 4 porcelain veneers. On the upper, we did 8 because he has a very wide smile." He wrote a beautiful review on Google and said for him it was life changing. So that's something we always like to hear from our patients.
And you hear that a lot, that is for sure. And who's next?
Thankfully, yes. So the next patient is James. James is
Wow.
25 and he fell climbing over a fence, quite frankly, and fractured those front 2 teeth.
Oh my goodness.
Fortunately, they fractured at that level. It didn't require root canals. And for James, we did 4 porcelain veneers, reshaped the bottoms, whitened them. And actually, in 3 appointments, we changed his smile. And he and his mom and dad were very thankful that we were able to do that in such a quick fashion and give him such a beautiful smile.
Turning a bad thing into a phenomenal thing. How about that?
Oh, I like that description, Joe. That's great.
Yeah, it's so true.
So this
Wow.
is this is Lisa, and Lisa came
Okay.
to us. She didn't like the way her teeth had looked. We talked about different options. Bonding in her case was something that's quick. She's a nurse. At this point, she wasn't able to do veneers, so we did in 2 appointments. We reshaped the bottom teeth, did some upper bonding. In the future, we may do some veneers, but what a difference! And she said she finally feels comfortable with her mask off, showing her smile.
You know, it's so fascinating, doctor, because you say you reshaped her teeth, but it looks like she went through 2 years of orthodontics. I mean, it's just fascinating. Now you could straighten something out like that.
Right. In some cases, Joey, thank you for pointing that out. We do need to use the help of an orthodontist, but sometimes we can do it just by
Right.
reshaping and making a huge difference in a very quick fashion.
2 appointments. Okay, we
To
have time for one more. Who's next?
and so this is my friend Lynn. So you mentioned about reshaping. So you see how her lower teeth look. So we
Oh yeah.
reshaped them. We did 8 porcelain veneers. Joe, she had 2 old crowns. Those are porcelain on metal that were done 20 years ago. She couldn't wait to get rid of them. We used all porcelain on the top, all porcelain on the bottom. And you can see what a difference it made. It did take 3 appointments, but she said it's been life changing for her, especially being self conscious. And now, as an attorney, she's no longer wearing a mask, Joe, and she's in front of people. So she said she feels much more comfortable.
Well, now it's that time of year where things should start blooming, including your smile, either in Zoom, in the Zoom world, or in person. It's so important to make that impression on the people surrounding you. So let Dr. Marsh and his team help you bloom. Simply give them a call at 440-461-1003 or log on to his appropriately named website, clevelandsmiles.com. Thank you, doctor.
Well, it's always my pleasure, Joe.